record. Okay, so we're officially recording, which means we're going to officially just go ahead and get started. Hello, everyone. I'll do sort of a formal introduction of myself and a mini introduction of Dr. Fiske, who can explain their expertise much more eloquently than I can, because it's so impressive and so helpful to those impacted and living with autism spectrum disorder. And we're so glad to have this content be brought to our students today. I am Dr. Lauren Snedeker. I'm a social worker, assistant professor of teaching, and also the director of the Aging and Health Certificate program here at Rutgers. I also am the faculty coordinator for the Fiddle Fellowship program at Rutgers School of Social Work. And these programs both focus on social work students and education, encouraging and helping and supporting students get skills and exposure and information around varying caregiving, aging, and health experiences. So glad that you could all join us this afternoon for our first Aging and Health Certificate Speaker Series event. These events are all virtual. If anyone has any questions, please reach out to me. You can find me on the faculty page website, on the certificate website. For those joining, I'll put my contact in the chat, although I have all of your contacts, so I'm sure you know how to get me. Without further ado, Dr. Kate Fiske, our wonderful guest speaker for this afternoon, who is going to be speaking again about autism spectrum disorder, its impact on family and caregiving, sort of across the lifespan is our goal. Dr. Fiske is a clinical psychologist, the founder and director of North Star Family Autism Center. And Dr. Fiske, if you could just share a little bit more about yourself, whatever you'd like. You have such an impressive resume and experience in this profession. So I'll pass it over to you to share more about that and get us started.
Sounds
Thank
great.
you.
Thank you, Lauren. Lauren, the one thing before I get started, if you can, because right now screen sharing is disabled, and so just swap that on while I get my introduction. Great, perfect. So thank you, Lauren. Thanks for the invitation. I'm glad that we were able to pull this together. I'm glad you guys were able to chisel some time out of your days, because I know that that is not an easy feat, especially as we're easing into the first. Is this the second week of your semester? It's a lot. It's a lot coming at you, and we've had so much snow and ice and cold and all the things. So Lauren did a nice job introducing me. I'm no stranger to Rutgers. I was a graduate student at Rutgers. I did my doctorate in clinical psychology at Rutgers, and subsequently was a faculty member at the Graduate School of Applied and Professional Psychology, and worked at the Douglas Developmental Disabilities Center on campus. I was there as a graduate student, and then as a faculty member. I was faculty for 12 years. So only just left Rutgers recently, and that was to create this private practice, North Star Family Autism Center, which is designed to support the needs of individuals on the autism spectrum, but their families. I was doing a lot of that work at the DDDC. I was the director of family autism services there. I wanted to make sure that the work that I was doing was really pushing out into the community. Rutgers is a phenomenal, place to be. I valued all of my coworkers there. And this was an opportunity for me to bring the work and everything that I learned into this community-based setting. And it has been an incredible journey. I do a lot of work. I just finished up an intake, about 8 minutes ago. So it is work that I do with individuals from childhood, so really young kids, through adulthood. The intake that I just did was for a person who is wondering about whether they could be on the autism spectrum, and she's 30. We have clients as old as 50 that we work with autism, but we also work with their families. We work with some siblings, but primarily the family members that we work with are parents. Sometimes the parents are coming in and working with their child, whether it's a 5-year-old or whether it's a 40-year-old. I have a session later this afternoon where it is a 40-year-old and his 2 parents who attend those sessions. But sometimes I'm working with the parents on their own. as they are working to cope with their experiences in raising their child with autism. Again, whether they're teeny tiny or whether they're adults, it's a really very unique experience. And so the work is huge. It's a broad range. Every case is so different. I spend my time really kind of problem solving each individual case. It's unfortunately not a manualized treatment for every case that comes in, and that makes things really difficult because I have to think so carefully about the system at play and who these individuals are and what their skills are when it comes to an autism diagnosis. But it's been rewarding to develop these relationships with these families. So what I want to talk through today is giving you kind of an overview of parents' experiences. I'm not going to be talking as much about autism unless it's related to the experiences of parents. So I'll be talking about the diagnostic criteria and symptoms because that is often what drives some of the stress that parents might discuss. Okay, so let me share this. You guys can see these slides okay?
Perfect.
Okay.
Yeah.
And I'll talk through this. I mean, a lot of the work that I did at Rutgers and that I still continue to do is educating professionals about the experiences of family members. Very often what we talk about in any field, right, is the needs of the individual with autism. I'm a clinical psychologist. I'm also a board certified behavior analyst. I've worked in schools and inpatient and outpatient settings my entire career. And I have been trained to look at the needs of the individual and how we're going to support this person and change their behavior and help improve their life as much as possible. And in that, we can sometimes lose sight of the people who are around that person and what their needs are and how they are thinking or feeling about this very unique path that they're on as parents or as siblings. And so when it was early on in my teaching at Rutgers, one of the things that I did at the very end of every class, I taught this class in ABA at Gazap. One of the things I would do is I would bring in a panel of parents to talk about their experiences raising a child on the autism spectrum, and those panels were so transformative for the students in my class. Some of them had been in the field for years because it was a certificate program at the time. They would say, I've never even thought about what these parents are experiencing. And realizing that, I continued to bring those panels in, but also put together a lot of talks at conferences, one-offs at public schools. I've presented for nurses, bringing in these panels. And when I can't bring in panels, the words of parents that I've learned from, so quotes and videos to talk about what these parents might experience so that people can develop the empathy that they need and compassion that they need to help support them. I also authored a book based on the research that I did, very similar name, Autism in the Family, Understanding Parents and Siblings of Individuals with Autism. And that has been something that has really pulled together a lot of the presentations that I do. So diving into this a bit, I do like to start out these presentations with this quote, which I think is a really helpful way to kind of ground the talk. Jennifer Franklin, she's a poet who was quoted in Andrew Solomon's Far from the Tree. He had a chapter on autism, and she wrote about her child who had been diagnosed with autism. I did not only lose you in an instant, I abandoned the infinite possibilities of what you might have become. And this is her describing that moment of diagnosis for her. And every single time I read it, it kind of gives me shivers because I think for those of us who are parents, we recognize that when we have a child no matter how little they are, we already start thinking about what their future is going to look like, right? And that future can be incredibly normative and boring, right? It's the basics of health, happiness, maybe a nice apartment, those sorts of things that we really hope for our kids, finding their people, love, connection, and nothing extravagant. But when we have a child who is diagnosed with autism, all of the certainty, and parenting is uncertain, make no mistake about that, right? But all of the certainty that we think that we have in terms of those normative expectations are instantly lost because we really can't be sure what any child on the autism spectrum will be able to accomplish in their lifetime, right? And that is so terrifying for parents. And that uncertainty that they're kind of thrust into is a big driver of a lot of the grief that they experience and the stress that they experience. And so I won't talk too much about the time of diagnosis, but recognizing that diagnosis for parents of children with autism, I have when I do these little roundtables or panels, some of the research groups that I'll pull together, parents, whether their kids are young or old, can all talk about that moment of diagnosis and the experiences and the emotions that they go along with it. Resoundingly is that feeling of grief that parents experience. And numerous times I've had parents talk about feeling like that the autism diagnosis was a death in their family. Like they lost the child that they thought they had, and the child that they thought that that would become. And also grief about the loss of their own future as parents, and what they thought that was going to look like, whether it's the relationship that they have with their child or how parenting would change over time, right? And we have these roles that we certainly, and I'll talk about this in a moment, but for a lot of parents, early childhood, infants, toddlers, young children is an incredibly intensive time for parenting. And then the dependency that children have on their parents tends to let up over time. We kind of get into teen years, which are their own beast, certainly. But there's an independence there where kids start to, that's why it is such a beast, is that they are building their independence. They're growing away from their parents, right? And then certainly into adulthood and kind of have this idea of like being able to connect with, these adults at some point. Like you've grown these adults that you have in your life and that becomes very uncertain, and parents really kind of recognize that shift, that they kind of can't see that unfolding in the same way. So a lot of feelings of loss and devastation, anger about the situation, why us, this shouldn't have been us, anger towards people who were involved, whether it's other family members who suggested that something might be going on, whether it's the doctor who provided the diagnosis, guilt that they didn't catch it earlier or that they were somehow responsible for the autism diagnosis. It is heartbreaking when I hear moms especially talk about, well, if I hadn't done this when I was pregnant, or if I hadn't done this when he was younger, then this wouldn't have come this way. And that again is a very universal experience. I mean, I have done diagnoses and evaluations for families from other countries who, through a translator, have told me about these feelings of guilt that they have, that they somehow caused their child's autism diagnosis. And this general sense of feeling overwhelmed at everything that's coming at them. And some kids are diagnosed very young. Some kids are diagnosed as teenagers. And then we certainly know about the adults who are seeking diagnosis. But for parents, what do I do now? Especially at these younger ages where there's kind of like this window. They feel like there's this window of opportunity to get their child what it is that they need to change the course of things. That sense of how many things are out there that they should be doing, could be doing, that might change their child's future is incredibly overwhelming. And from there, a lot of the work that I do focuses on talking about parent stress, and what we know about parents of children with autism from young ages straight through is that they experience a level of stress that surpasses virtually any other parenting group, whether that is parents of neurotypical children, certainly, but parents of children with other disabilities like Down syndrome, chronic illness. This is the most stressed group repeatedly, and that goes for mothers and fathers. It bears out a little bit more severely, and depending on the study, for mothers, and is related to a lot of mental health concerns like anxiety and depression that both mothers and fathers will report. And when we look at the parenting stress, it's driven by, and this is where I said I would get into a little bit of kind of what is autism, right? What's at the heart of autism? The diagnostic criteria is focused on social communication, limitations in social communication area, and then kind of this repetitive behavior. And when we look at what drives parenting stress, impairments in child's communication, challenges with social skills, those are huge drivers, and not a huge surprise, right? So impairments in child's communication, if we think about parents who have really young kids, like infants, toddlers, part of why they are so hard is because there's such limited communication at those ages. It's their inability to explain why they're crying, why they're throwing this tantrum, what hurts, and that drives this big stress. And for parents of neurotypical children, that period is time limited. It feels endless, but it's time limited, and it will get better. And for parents of children with autism, that may never end, right? And there are parents of adults who say, he still can't tell me what hurts. And that hurts, right? To not be able to know how to help your child, or to not know why this teenager is throwing a complete tantrum right now and having this meltdown, will certainly relate to the stress that parents experience. Deficits in social skills. Parents certainly connect with their kids with autism. It's not the case that they're not able to kind of develop the loving relationships that we see in other families. The relationships look very different, right? The ways that they connect and the things that they connect over. There has to be a lot more adaptation for parents in terms of how they connect with their family. We have to work a lot with families about that, in terms of like, we know that you're not interested in his restricted interests, right? We know that you don't love football, but that is all your kid talks about. And so how do you find a way to connect with him about that, right? If that's his restricted interest, how do you connect about that? And so that can be really challenging for parents sometimes. And also just the concerns that they have for their kids in terms of how they're interacting with other children, right? Play dates can be very challenging, the stress of that, but then also looking ahead to what does that mean for college, right? We think that like having kids leave for college is stressful for any parent. Think about what that looks like when you have a child who is struggling with social skills with peers, with teachers, and how they're going to navigate this huge arena that is college. And that is, again, more work that I do in terms of talking with families about how we prepare for this college transition and helping kids find the right school for themselves. So that can be a huge driver, the social skills. The number one driver for parenting stress is challenging behavior. The higher level of challenging behavior that a child exhibits at school, whether or at home, or at school, aggressions, disruptions, self-injury, all of those are going to be enormous in terms of as it relates to parenting stress, repetitive behavior, routines, rigidities, right? I worked with this family where this was years ago. Everything in this child's house had to be exactly the same every single day, right? Like this light had to be on, this cabinet door always needed to be shut, this door always needed to be open, this stuffed animal always needs to be on this corner of the couch. And any deviation from that could result in a massive tantrum. And so like parents, siblings spent so much time making sure that everything stayed the same all the time, so that it wasn't resulting in this huge tantrum. And it could be small things. It could be a therapist driving up in a different color car than they had previously that suddenly would cause this huge tantrum. Um, and so then parents are so concerned about, their child's safety, their safety, siblings' safety, and, in that family. The siblings knew that when this happened, they were supposed to go upstairs and close their doors to keep themselves safe, right? That was, what their childhood looked like. And the parents had to make sure that everybody was safe. It's very limiting in terms of where they're able to take their child, how they're able to interact with other people. So again, unsurprisingly, a huge driver for stress. And as I mentioned, just the lifelong diagnosis and child dependency on parent. And so, listening to Lauren talk about kind of like the work that you're doing on aging and the aging population, I mean, I am working with parents who are in their 70s and 80s and trying to figure out how to get their child the support that they need and how to make sure everything is in place to support their child after they're gone, and not knowing where to start and how to work through their way through the system and everything that they need to, and thinking about now their adult siblings, right? And how they play into all of this. It is really challenging watching parents and parents regularly tell me, they're like, I'm too tired to do this. Like, I know what, if I'm offering suggestions, they're like, I know what you're telling me to do, and I understand why. I just can't do that, right? Like it's between, being tired or, physical limitations that happen, sometimes cognitive limitations that are happening through decline at that age, where it's just things are just not as feasible as they were when maybe they were younger. And the fact that these parents, I mean, they are living a life that they certainly didn't expect for themselves, right? In terms of having to provide this care for their child at this point in their lives. And so emotionally speaking, I have to work a lot through that, where it's like, this was not what you expected for yourself. And how do we manage that feeling that you're experiencing? So it's a lot for them. I talked through each of these. And when we talk about parenting stress, it doesn't, it doesn't remit, right? And so they, some people might think, well, maybe parenting stress is higher when a child is first diagnosed and then gets easier over time. And, research generally indicates that there's no linearity when it comes to parenting stress, that it really is kind of like this up and down. And I have been so fortunate to work with parents through the years, in the panels that I've done. I have one parent that I've worked with who, like I met her when her child was 3 and now he's an adult, and she has participated in these panels over the years. And so I've seen her kind of at these points where things feel really under control, and her stress is lower. And then the next year, everything will feel like it has exploded. And, behaviors have changed and needs have changed. And now, things are much more stressful, right? And so there's no linearity. One father that I worked with said when his son was diagnosed, somebody told him, now it's going to be like these bombs that are dropped throughout the course of your life, that feel just like this period of diagnosis, but like randomly at random points in your life. And he was like, and that's exactly true. That's exactly how it is. So they get these resurgences that can happen out of the blue, but they can also happen when they're really reminded of the loss that they've experienced. So the loss of the child that they thought they had, of the loss of, the parenthood that they thought they would have, the long-term nature of their child's diagnosis. Parents talk about birthdays as like this landmine, because it's this point where and a lot of parents do this, right? Where they look at their kid on their birthday and like reflect back on how much has changed over the past year. And that period of reflection is really challenging for parents who have a child with autism, because maybe they're looking and comparing their child to other children who are that age, or looking at them compared to other siblings, looking at how much they have or have not accomplished within the past year, or how much has changed. And so that can be incredibly difficult. And so whenever I'm talking with professionals, I always am talking to them about recognizing that this path isn't linear for parents and that any given day can be the day that's really hard. And so, when I'm working with, psychologists, behavior analysts, medical staff, anybody who's working with a family, and you have come up against a parent who's just really responding very negatively to something that is going on, sure, absolutely, kind of rethink what it is that you're doing, but also recognizing that on any given day, a parent might be carrying a lot of stress into this situation, and it can be really helpful to recognize that in the work that you're doing, to make sure that you're building in that empathy and compassion and taking the time to check in with them about those things and not just assuming that they're being argumentative for the sake of being argumentative. And then that's the stress related to just parenting a child with autism. And then we have all of the other things that go along with life that become compounded when you have a child on the autism spectrum, right? So changes in employment and division of labor, these throw anybody for a loop at any point in their lives. But a lot of families will make these shifts in their family structure because they have a child diagnosed with autism. So it's more likely to be mothers who leave the workforce, either partially or entirely, to help manage their child's care. Certainly, I've seen fathers do the same, but it tends to be more often mothers. And so that factor. So for a lot of parents, I mean, if you think about yourselves and all of the work that you've done to get to this point in your academic career, right? Like a lot of parents have done that same thing and then walk away from their career to help care for their child, and kind of the identity shift that happens for parents and the frustration that can happen for parents with that. And again, that shift and grief about kind of what their future was going to look like. And then at home, just working through that division of labor. What does this mean? Who's taking over what? Who's managing childcare? Who's attending appointments? And then all of the things that go into things like managing challenging behavior, those sorts, and siblings and cooking and cleaning and all of the other pieces that are in a household regularly. The financial impact on families who are raising a child with autism is huge. We get some boon these days with insurance coverage for specific treatments, right? So for a lot of families, applied behavior analysis is covered by insurance. I will tell you, and I am recognizing this much more now in the community than I did when I was at Rutgers. The insurance hurdles are enormous for families. The hurdles that they have to jump through, even though insurance covers things, how difficult it is to find quality individuals to provide those services. It's incredibly disheartening, and families will still pay out of pocket for services because it'll make things move faster when they can. Or, maybe there are professionals who are not ABA that they want to employ, right? Who they might have to pay out of pocket for. So it's an incredibly expensive aspect of the autism diagnosis, is just kind of like all of the care that is required early on, but then even as you look into adulthood, right? As we look at things like things that are not provided by the state, residential settings, social skills groups. I mean, some of these things you can pull from funding. Again, that's its own piece to navigate, but it's a lot. There is more conflict among parents of children with autism than there are among other families. Some research has shown higher rates of divorce among parents of children with autism than when compared to parents who do not have a child with autism, but certainly we see those challenges with conflict. And I see this regularly with families who are just struggling to figure out how to get on the same page about things. And this is, if any of you think about your own relationships that you have now or in the past, you're going to disagree about things. That is just the nature of the beast when it comes to relationships. And sometimes you've figured out how to work through those challenges. But if a couple hasn't figured out how to work through disagreements, it will become very obvious when they have a child diagnosed with autism, because there is just so much that comes at them and so quickly. And the decisions and the disagreements have or seem to have such a huge impact on their child's future. And so the disagreements are on a much bigger stage. And that can be, and parents are just coping so differently very often. And that's what I find a lot is two parents just coping with things in very different ways. And that can result in a lot of conflict where parents are not necessarily understanding each other in terms of what it is that they need from each other. And so that is, while we're not child and family therapists, or sorry, couples and family therapists, that's the work that we have to incorporate, right? Is we talk a lot about communication and coping skills and problem solving skills within a family as we work with the child to help everybody improve. And then decrease social support. So I said that challenging behavior is a huge driver of parenting stress. Decreased social support is another enormous driver. This happens just naturally for parents. I think even when you just have children, period, there can sometimes be decreased social support because maybe you have peers who don't have children, and it can be hard to kind of connect with them in the same way. But then when you have a child with autism and nobody else does, it's even harder to find those supports and people to connect with. And when you have a child with autism and potentially challenging behavior or rigidity, it can be hard to then put yourself into social situations where you can connect with other people. Even family gatherings can become very difficult. Certainly friend gatherings, finding babysitters so that you can go and connect with other people, all of those things can be difficult. And what we find is that for parents in early, when their children are young and then through adulthood, that parents who have lower perceived social support, and perception is big, right? So it's not necessarily how many, like if I look at them and be like, oh, look, they've got tons of people surrounding them. That's not the issue. It's how much they perceive they're supported by those people, right? How much support they perceive to have. That is an enormous driver of how much stress that they experience. And then certainly maintaining relationships with siblings. And we do a lot of work with siblings. I've run a sibling support group for years out of the DDDC. I did it as a graduate student. I continue to supervise it now for the graduate students who are currently there. And so helping support siblings, but that's a lot of the work that parents are doing, is supporting siblings on their own or helping them find arenas where they can get that support and concerns about their mental health and well-being as well. I talked about this a little bit. This is a quick slide just about kind of parent coping and how different it can be for different parents. So problem-focused coping being those parents, and I can spot them a mile away. These are the parents who kind of come armed with all of the knowledge about autism and treatments, and they're amazing advocates for their kids. And a lot of fathers, I won't make a sweeping statement, but a lot of fathers tend to be more problem focused, problem focused, and kind of like, this is how we're going to solve the problem. And the challenge comes when autism isn't necessarily a problem that can be solved, right? There might be small things that we can kind of work through, but it's not something that we're going to overcome. And so then we've got to think about emotion-focused coping is like, well, in the face of that, how do you manage the emotions that are coming up for you? Is it distraction and disengagement where you're just like avoiding the emotions altogether? Or are you working to actively cope and come up with coping strategies for them? And I'm not going to go too in depth into them here, but things like, CBT, right? So cognitive behavior therapy, cognitive reframing, mindfulness-based approaches, psychological acceptance that we see within acceptance and commitment therapy. That's a lot of what I draw through with parents in terms of like, yeah, you've got these really big emotions and we're not we're not going to be able to get rid of them, right? That's one of the biggest things that I talk about with parents is like, I can't change your emotions, that your emotions are completely 100% valid. What do we do while you're experiencing those emotions, right? Like that is, what do we do in the face of it? What are you willing to tolerate, or kind of, what are you willing to experience rather, in terms of the emotions that you have, and still move forward with the work that you need to do with your kid. It's incredibly hard work for parents. And I'm a very like sympathetic crier. And so there are like definite sessions where I'm like, whoa, keep it together. Because some of what parents experience and share is just so raw, in terms of the emotions that they have and the grief that they experience. So it can be, it's, learning some of these skills can be incredibly helpful, but hard work. But I've seen parents make amazing progress, and in terms of how they're doing this, but then also what that means in terms of the steps that they're taking with their kid, and seeing improvements there as well. Because it's really hard to do the work that you need to do as a parent when you are getting bogged down in all of these emotions. And so we see progress in both of those areas. So, I want to make sure that we have time for questions and any thoughts that you guys have. I try to think in the presentations that I do about kind of what different groups can do, in the face of all this. Like I just, downloaded all this information for you really quick, like have a knack of getting just, throwing all of this at you at once. It's like, well, what do you do with this, right? And I think, here are some of the main points as I think about like social workers and the role that they can play for families and the work that they might do with families. Some of the take-home points from what I've shared today, one, recognizing that parenting, grief, and stress are not linear. That it's such a roller coaster for families. I remember this one family, this one mom telling this story, about being blindsided by the emotions that she experienced. And it happened when she was driving in the car, which is like normal everyday weekday. And she was driving the car, and her kid was in the back seat. And he, he's like tapping on the window because that was one of his motor mannerisms that he engaged in. And they drove past a yard where there were a bunch of boys his age out on the yard playing football together, and not a parent to be seen, like no parents in sight. And she just had this realization at how much she had lost and how much her son had lost in that moment, right? That he would never be in that place. And she would never be the parent who doesn't even know where her kid is, right? And she said she just lost it. She absolutely lost it. And that is just one of those moments that is just like, you have this grief or stress that suddenly just skyrockets. And talking to professionals, it's like any day can be that day, and just really recognizing that. And when you have those moments with families, stepping back, like this doesn't have to be all about me. This isn't necessarily me, right? There are other things that are in play here, but making sure that you're checking in with parents about those things. Keeping in mind all of these variables that can impact parenting stress, right? And helping parents problem solve where you can. There's a lot of things that are out of their control, but where can they get the support that they need, right? So if challenging behavior is such a huge driver for parents, how do we problem solve that? What support do they need, right? Maybe you are not the one who can help, decrease their child's problem behavior, but how do you find the supports that they need, right? Are there other professionals that they can connect with? Are there services that can come into the home? Are there respite care providers? I have such a small caseload relative to other practices because so much of the work that I do is that case management, right? And figuring out what does this family need and how do I connect them to those things? And I wouldn't be able to do that and have this enormous caseload. But that's so often what it is that parents need. And so anybody who's working with families in the position that you are is really recognizing like what's out there, how do I connect them? Or how do I connect them with people who at least know more than I do about the resources that they might need? So linking parents to those forms of support, looking out for things like social support groups, clinicians who have knowledge about autism and can provide that support, knowing what's available in terms of like what's offered through the state or through the education system. If you don't know those things, who does that you can send them to, that sort of thing. But then also recognizing that you are social support. And so often I have to get clinicians to just slow down and listen. So often, and we all fall victim to this, where it's just like, go, 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 get things done. And sometimes somebody just needs to be heard, right? And I think there's this great story. Bridget Taylor is a Gazette graduate, and she has a center in North Jersey. And she's phenomenal, does a lot of work in kind of parents' experiences as well. But she tells this story about this dad who came into the school just furious with them about something that had happened related to transportation. And he was just so angry about it. And every single time he would say something, somebody from the school would jump in and say, yeah, but what we did, yeah, but and just interrupting him and coming back. And it was just this escalating moment. And then finally she interrupted and she said, everybody stop. I think we just need to listen and hear what this parent has to say. And she let him tell his story. And she said, as she watched him, he just visibly kind of deflated, right? Like, and was able to then enter into a problem-solving conversation because people stopped and listened to him. And even, the intake that I just finished, at the end, she's like, you have listened in a way that other clinicians don't. And I think that that is just such an important piece as a clinician. What to take into these relationships with families is how much people just want to be heard and they want to share their experiences, and you can be that, right? And really listen. And then once you're finished listening, help them figure out the next thing. But so often we're so focused on what we're going to say, how we're going to respond, how we're going to solve this problem, that we don't actually listen. And so that's a big piece of it. And then where possible, right? If this is within kind of, what you're comfortable with, within the work that you're doing, facilitating skills like mindfulness, psychological acceptance for families is going to be, for parents in particular, is going to be very key. Research has shown repeatedly that these approaches can be beneficial for individuals on the autism spectrum. Susanna Idarola actually did a really nice dissertation that was subsequently published. She was at Rutgers on mindfulness for parents of children with autism and the benefits that it can have. And again, it comes back to this idea that we can't change all of their experience, and we certainly can't get rid of the emotions that they have, because their emotions are going to be there. And so what do we do with that, right? How do we make, and I talk about this a lot, like how do we make those emotions a little quieter? I talk about like, right now your emotions are riding in the front seat of this minivan and we need them to be way back, like the kid in the way back who's like calling to you and you can kind of hear them, like they're still there, but they're not so center stage. And there are some pieces and elements from mindfulness and psychological acceptance that can help parents do that, and then move to this space where they're able to problem solve more effectively. So those are some strategies that I think are some things to kind of keep in mind in the work that you do. You're all going to, at this, it's in the world that we're in today, it's very rare to be working in a helping profession and not coming across individuals with autism or their families. And so having these, pieces in mind can only be beneficial in the work that you do. So that's what I have in terms of a presentation. But I did leave time for questions that I want to make sure that we give time for as well.
Thank you so, so much. I took such good notes. I have some good reflections and connections I was making, Dr. Fiske, as you were speaking about respectfully, my area of practice being so focused on working with older adults. And so many of the students here are also in the Aging and Health Certificate. So they might be applying this as well. This living experience throughout the lifespan. I want to first, though, give the opportunity for folks joining today to ask questions. So just going to go ahead and open it up. We're a nice sized group, so I think just taking yourself off mute is perfectly fine. But if you're in a place and space where that's hard, you can also drop it in the chat. But yeah, if you have any questions or comments, please share with us. And thank you so, so much for such a great presentation, so informative and helpful. Any questions or comments?
This is my favorite part when it's like such a small group. Like I'm like, oh my gosh, now I've got to think of a question, and there are only 9 people here to ask a question. Yes, totally get it.
Actually, I have a question. First,
Sure.
thank you for providing really great presentation. Um, I'm just wondering, you have observed any kind of intervention to improve family relationships and dynamics to improve their mental health? Yeah.
Um, so there are any number of interventions that can be used, and here's the challenge, right? And I think that this is one of the things that I've found most challenging moving into this private practice. Is, like I joked before, there's no manualized treatment for the work that I'm doing. There's also not a lot of research on treatments that are effective for families. We know different manuals that are very effective in the general population, but what does that mean when an individual has autism? Does it translate, right? And so I think about like Russ Barkley's Define a Child manual, right? In terms of like how we're treating oppositional defiant disorder or things like things that certainly come up when we're talking about teenagers on the autism spectrum. But like, how does that play out when we're talking about parents of children with autism and the family dynamics? Because the base of that is so great in terms of thinking about problem solving skills that you develop, communication skills, and um, there's a lot of assumptions in something like that talking about communication skills and interactions are going to come very easy, right? Be very understandable for individuals, the teenagers who are involved. And that's not the case for individuals on the autism spectrum. There's a lot of extra things that have to be layered in, right? So the work that I do pulls in a lot of these evidence-based practices. Everything that I do is grounded in evidence, right? So I'm turning to those evidence-based practices, but I have to make modifications and figure out what's going to work for each individual family. And so I would say in terms of what's working for families, it ends up being a mix of so many different things, right? Certainly I bring in things from applied behavior analysis in terms of skill building, and I have families collect data on themselves or on their kids and work to change behaviors. But I will pull in things from some of like the manualized treatments, whether it's for anxiety or oppositional behavior, at different pieces, especially if it's focused on communication. And then I have to turn to, there's really amazing research and guidance for things like couples and family therapy, which again, I'm not a couples and family therapist, but I have to pull in elements of that to be able to navigate the system. You cannot work with an individual with autism and not be cognizant of the system and how all of those players are working or not working together. And those things, if you don't address them in some way, it's going to be very difficult to make progress. So that doesn't quite answer your question because I can't point to anything specific, but it tells you a little bit about the process in terms of how I have to start somewhere and then pull in elements that are going to be most effective.
Thank you so much.
Mm-hmm.
Oh, there's a question in the chat. Do you see that? You see that,
Yeah.
right?
So you mentioned that care is not linear. Okay. So Rob, and maybe you can jump in, right? So you're saying, is it the same for the work you do with parents? Can you clarify your question a little bit? Sorry.
Yeah, sorry. Can you guys hear me? We have a lot going
Yep.
on right outside
Yep.
the office. I know that was a loaded question. Pretty much what I'm asking is, you described a lot of work with clients is obviously not the same. Everybody's different in their own individual
Yep.
way. When it comes to parents, are there certain strategies, like for example, if you saw a set of parents that were dealing with something very similar to another set of parents,
Yeah.
or caregivers, is there like generic strategies that you go into to start and just try and digest what's going on in their situation, or is working with the parents and caregivers something that's still very loaded, kind of similar to how clients would think?
Yeah, so I think that is the nice thing, right? Is that it is, well, and the work that can be hard to do, but is necessary, is really identifying what the goals are for a family, right? It's just like, what if we're successful here, what will you be doing more of when we're done, right? And I love that question because it essentially tells me what are my goals for treatment. And it's like, we want to talk to each other without screaming all the time. And it's like, great, okay, we can do that, right? And you start to hear some of these common goals that can come up repeatedly across families. And when that happens, and especially if you've worked with a family that's similar, it's like, great, what a relief, because we can tackle that using an approach that I've used for this other family. The caveat being that, as you know, all families are so different, and individuals on the autism spectrum are unbelievably different. And there are some who are going to be very open to some of the strategies that you try. There are some that are going to be incredibly resistant. There are some that don't have the skills to pull off what it is that you're asking them to do. And so there are things, I mean, it's funny. There are treatments that I've tried and been successful with, and then the next family comes in, I'm like, oh, there's no way I can do that, right? Like, it's just that's not going to be possible. Like, maybe I'll try it, maybe I'll adapt it, but it can't be so straightforward. I'm lucky I have a couple clinicians that I work with in my practice, but then also in New Jersey, and we all spend time kind of problem solving together these very unique cases, right? Because it's more likely the more heads we get together that somebody has seen something similar, that they might be able to recommend a specific strategy. I would love to get to a point in my career where it's like, oh, yes, this is the approach I'm going to use. This works for in this case, right? But it's families are so diverse, and that's not unlike the general population anyway, right? But certainly autism throws in these extra wrinkles.
Thank you so much.
Mm-hmm.
And just to add to that, I think, Dr. Fisk, that, assessing kind of the relationship between parental caregivers is like a very specific, and it seems very important early on to kind of inquire and be curious about. And that, in social work, we talk about, of course, I'm going to, just take this opportunity. We talk about those presenting problems and the underlying problems, right? For folks, remember practice one. And, I'm thinking that the relationship of the couple, or of the parents, if they're coupled or not coupled, the relationship of the family caregivers, whoever they are, because it could also be grandparents, kinship, whomever they are, I think that could present as an underlying issue or concern or challenge in the care that is being provided to the individual living with autism.
Mm-hmm.
That's an interesting connection to me.
Yep. And then
general approaches, right? Like that,
exactly.
It's like a really important thing to assess very early on in the work.
Mm-hmm. And then it depends on how willing everyone is to work on those underlying problems, right? So often still, right, even though the practice was founded primarily first for families, right? And then I was like, I can't work with families without also addressing the needs of individuals. And so even with that, parents will very often say, like, no, my kid is the problem, right? Like, I need to fix my kid. And I'm like, I can't fix anything with everything that's going on in the background, right? With all of these underlying concerns that are going on, but then getting the buy-in and the willingness to work on those other pieces as goals can be a challenge. And also figuring out, I mean, it becomes very tricky as a clinician who maybe was hired to be the clinician for a child. At what point does like couples work or family work become too prominent that you're like, this is not appropriate for me anymore, it's actually more beneficial for you to find a separate therapist who can do that couples or family work. And how much is like, you know, is my work informed by that work versus being all about it? And so I've always got to kind of like think about that piece in it. And I think it's one of the it's not a stumbling block, but it's something that I spend a lot of time thinking about in the work that I do. 100%.
Yes, yes, absolutely. I think when we're talking about family work or individuals going through a crisis that impact family or a change in health, or I'm, preparing for a presentation tomorrow on functional loss for older adults and things like that. It's so important to take that kind of wider view, but also balance who's the client, who's the patient that you're working with, and how much, as you said, of the work that you do with others impacting that person is meaningful versus referring for more support. That just resonates so much. It's so interesting, all the different parallels of our work. With our last few minutes, I'd like to make these connections. Please continue to ask questions in the chat too, but I'd like to offer these additional connections based off of your presentation, thinking about, especially in the experience of adults who have been, parents of a child with autism who is now an adult themselves, and thinking about that difference in experience, what it was like to encounter and experience a diagnosis for a child 40, 50 years ago. And when you're thinking about and explaining that resurgence and the grief, how that transcends throughout the lifespan, how parents 30, 40 years ago might have been disenfranchised in their grief upon receiving a diagnosis because, respectfully, and Dr. Fiske, you're the expert, but 30 or 40 years ago, I think diagnosis was even more challenging, even more difficult, and even less discussed amongst, neighborhoods and communities and in schools. And I'm just thinking about how that enters the work, or how that will enter our work, especially folks working with older people who have been, living this experience, but may not have ever had the opportunity to really connect with that emotional side of coping. And there's a very interesting documentary called Mimi and Donna that I often give to my students as an alternative assignment. And it's a documentary that discusses care transitions. It's activation warning. It's a very heartbreaking but resilient story. But essentially, I think about Mimi, who's the mother of the child living with autism spectrum disorder, unofficially diagnosed because she's in her 50s. And I'm just thinking about kind of what that's like now, where parents didn't have folks like Dr. Fiske doing this important work earlier in history. And then the resurgence again of the grief, marriage, weddings, caregiving. We talk about caregiving, that role reversal, the adult children caring for the parents. That's not happening necessarily for folks impacted by this. So those are just some of the thoughts that came up for me. And, I just invite Dr. Fiske to respond and anyone else. But thank you.
Yeah, of course. I think you're so right. And I have not seen that film, and I'll have to look at it because it is an incredibly challenging group to work with. I think one of the other pieces related to kind of how long ago their child was diagnosed, certainly that comes to like the lack of support that was available at that time, kind of what a diagnosis meant for their child at that time. I mean, basically it was like, if they were able to stay in mainstream public school, it was likely that they weren't getting diagnosed, right? More likely that they were getting diagnosed if, they really needed considerable supports, and the supports just weren't there, right? We didn't really have public school programs for children with autism that many years ago. I mean, I have parents who talk about, like, my kid was the first kid to go through the public school in their program. A lot of it was like, maybe out of district placement, the quality wasn't great. For parents, there was not a lot of education for them about autism, right? And so they'll share stories about getting a diagnosis and then basically like getting shot out of a hospital setting, and that's it. Like, go fend for yourselves, right? Without a lot of a guidance. And I run into parents now, and I'll be talking with them about, their adult child's diagnosis, and really find a lack of understanding about what autism is and how it has affected their child, which very much affects their expectations that they have for their child. It can be really challenging in terms of family interactions, and how sometimes punitive parents can be because they don't understand how limiting autism can be and why it's limiting in that way. So I think that there's so many effects, right? And Lauren, you're so right? Like, the grief resurgence that happens on top of this lack of understanding can be incredibly challenging. It'll be interesting, and I can't say, right, like, how this group of aging parents differs from parents who are getting a diagnosis, 40 years in the future. I'm not sure. I hope that the support is better, that they feel like they had better paths, that they were more clearly guided along things. But a lot of these parents have just had to kind of fend for themselves. Very challenging.
Absolutely. Absolutely. And it's challenges that are difficult to speak to, but just so important for us with using our positions and our experiences to amplify and that's certainly the goal of today, to put this experience and information out there for more to understand and recognize, and from your position, sort of how you can affect change, continued change and continued support. So let me just pause here and see if anyone else has any other questions or comments. We're getting lots of thanks in the chat. I also posted the information about the film that I referenced if you're interested. And all of Dr. Fisk's information as well. Okay. Well, I want to thank you. We're at 1:05, but I want to thank you so much for all of the wonderful information you shared with us today and giving us some of your time. It was so, so interesting and so informative. And I'm excited to share this with others so that others can become more familiar and prepared to engage in this work.
Sounds great. Well, I really appreciate the invitation again. I'm glad we were able to connect this way, and I hope that it was helpful for this group and then for everybody who's watching it in the future.
Thank you. So I'm going to go ahead and stop our recording now. So thank you